All right, welcome to Module 3. This is where we're going to start looking more closely at how HIV is affecting the body and why understanding the immune system is important for us as addiction counselors and behavioral health professionals. And before we go any further, I want to kind of emphasize again that this is not a medical training course that's designed to make you a healthcare provider. So you're not expected to diagnose HIV or interpret lab values independently. You're not going to be expected to provide any medical treatment. But counselors often work with people who are living with HIV or who are at risk for HIV exposures, or maybe they have fears or misunderstandings about the disease process itself. And because of that, it's important to understand the basics of what HIV does inside the body and how treatment is going to help to manage the condition. So in this module, we're going to talk about the immune system in simple practical language. We're going to look at the role of CD4 cells and how HIV is going to attack the immune system over time, and what viral load means, and why treatment can dramatically improve health outcomes for people. So a lot of clients, they have this vague understanding of HIV progression, and some believe that HIV immediately causes severe illness. Other people believe that HIV is no longer serious at all because the treatment exists. So the reality is a little bit more nuanced, and counselors benefit from understanding that balance. And understanding these concepts helps to reduce stigma. And when counselors can understand HIV as a chronic medical condition rather than a moral issue or a lifestyle disease, then it kind of changes the tone of the conversation with the client, and it also improves our empathy and education and professional confidence. So as we're moving through this module, I want you to focus on understanding the big picture. Rather than just memorizing the medical terminology, the goal is not perfection. It's just competency and comfort when discussing these topics in professional settings. So the immune system is the body's defense system. And the primary job of the immune system is to identify threats and then respond to those threats so it can keep the body healthy. And every day, the body's exposed to bacteria and viruses and fungi and other different types of microorganisms. And most of the time, we don't even notice these exposures because the immune system is consistently working in the background to protect our body. But the immune system is made up of a lot of different cells, tissues, different organs or whatever that work together. And these are going to be things like your white blood cells, your lymph nodes, the spleen, your bone marrow. And there's also specialized immune cells that each have different jobs. And so one of the important things to understand is that the immune system is not just about fighting sickness. It's about communication and coordination. And certain immune cells are going to help signal the body when there's a threat and direct other immune cells on how to respond. And when the immune system is functioning properly, it often stops the infections before a person even realizes that they were exposed to something harmful. But HIV specifically targets part of that defense system. And so that's going to weaken the body's ability to protect itself over time. And so for counselors, understanding this immune system is going to help us explain why HIV is different from a lot of the other illnesses, because it doesn't just cause one isolated infection. What it's doing is it's damaging the body's ability to defend itself against a lot of other illnesses. And that's why untreated HIV actually leads to severe complications if the person doesn't receive medical care. And one of the most important concepts in understanding HIV is the role of the CD4 cells. So these CD4 cells are a type of white blood cell, and sometimes it's called T helper cells. And so their job is to help coordinate the immune system's response to an infection. So we want to think of the CD4 cells as like communication leaders or coordinators within the immune system. And they're going to help to signal the when the body needs to respond to a threat, and it's going to help direct the other immune cells into action. And so when HIV comes into the body, it specifically targets those CD4 cells. And that's the reason why HIV is so dangerous when we leave it untreated. So instead of attacking random cells, HIV attacks cells that are central to the immune system's ability to function effectively. And then over time, HIV is going to enter the CD4 cells, and it's going to use them to replicate itself. And then it destroys them in the process. So it's replicating itself, but destroying the cell. And then as more CD4 cells are damaged or destroyed, the immune system becomes a lot weaker. And so a healthy person generally has a higher CD4 count, meaning that they have a lot more of these important immune cells available to protect the body. But as HIV progresses, without the treatment, the CD4 cells are going to, the count is going to decline very significantly. And so when those levels become very low, the body is going to become increasingly vulnerable to infection and illness that wouldn't normally pose any serious danger. And we as counselors don't need to memorize exact laboratory ranges, but we do need to understand the general role of a CD4 cell because it's going to help us understand HIV progression and treatment goals. So another important term that we need to learn is what viral load is. So viral load refers to the amount of HIV present in a person's bloodstream. And so we measure this through medical testing. A high viral load means that the virus is actively replicating and there's a larger amount of HIV circulating in the body. A lower viral load means that treatment is effectively suppressing the virus. So modern HIV treatment out there focuses heavily on reducing viral load to extremely low levels. In a lot of cases, the treatment's going to lower the viral load to what we call undetectable. And undetectable does not mean cured. It just means that the amount of the virus is so low that the standard test can't detect it. And this is really important because maintaining an undetectable viral load really improves the health outcomes and it significantly reduces the transmission risk. And we may work with clients who feel hopeless after diagnosis. So understanding the role of treatment and viral suppression is going to help counselors provide realistic encouragement without giving medical advice. And it's also important for counselors to understand that treatment adherence matters. Missing their medications consistently is going to allow the virus to become active again. And that would increase the viral load and thus harm the immune function. So behavioral health challenges like depression or substance use or homelessness or transportation barriers or unstable living situations, those all affect treatment adherence. And that's one of the reasons why counselors play such an important role in HIV care systems. So HIV progression generally happens in stages when a person does not receive treatment. So the first stage is called acute HIV infection, and this happens shortly after exposure. Some people develop flu-like symptoms during this period, while others may not notice any symptoms at all. And because those symptoms can resemble common illnesses, a lot of people don't realize that they were exposed to HIV during that stage. Then the second stage is called clinical latency. And during this phase, the virus is still active, but it reproduces a little bit more slowly. So the person appears healthy and fine for years, especially early on in that process. And this stage is important because people don't know they're infected unless they're tested. And without treatment, HIV is going to continue to damage the immune system gradually over time. And eventually, if the immune damage becomes severe enough, the person may progress to advanced HIV disease or AIDS. And at that point, the immune system is significantly weakened, and that's going to make opportunistic infections a lot more likely. And again, the modern treatment has dramatically changed this progression for many people. And a lot of people living with HIV today never develop AIDS because treatment suppresses the virus before severe immune damage happens. So understanding progression helps counselors explain why testing and early diagnosis and treatment engagement are all important. Opportunistic infections are illnesses that are taking advantage of the weakened immune system. So we call these infections opportunistic because they happen when the body's normal defenses are no longer strong enough to fight them off effectively. And so this might be like certain pneumonias or fungal infections or infections that a normal healthy immune system would usually control a lot more easily. And for people with severely weakened immune systems, these infections are going to become very serious or even life-threatening. And that's why HIV treatment is really important. The goal is not simply to reduce the virus itself, it's to protect immune function and prevent severe complications. And clients living with HIV may experience fear around these issues, especially if they knew somebody who had become severely ill in earlier decades before the modern treatment improved. And so we have to avoid fear-based messaging, while at the same time we still need to recognize that untreated HIV can still have serious consequences. A balanced education is really important. So we don't want to minimize, but we don't want to catastrophize HIV also. So the modern HIV treatment is called antiretroviral therapy, or we abbreviate it as ART, A-R-T. And these medications work by interfering with the virus's ability to replicate itself. And when the treatment is consistent and effective, the viral load becomes undetectable. And so that's going to allow the immune system to remain healthier and stronger. And we know that the treatment has dramatically changed HIV outcomes over the past couple decades. And people living with HIV today are going to work and raise families and maintain relationships and live long, productive lives. But the access to treatment and consistent care are going to remain major challenges for a lot of vulnerable populations. Substance use disorders, mental health concerns, poverty, stigma, unstable housing, a lack of health care, all of these interfere with treatment consistency. And counselors can often support clients not by managing their medications directly, but just by helping address behavioral or emotional or environmental barriers that are affecting the overall health. So as I close this module, I want you to remember that HIV is fundamentally a condition that affects the immune system. And understanding CD4 cells and viral load and disease progression, and also understanding treatment, is going to help counselors communicate more accurately and compassionately with clients. We don't have to become medical experts here, but understanding these basics is going to allow you to reduce the stigma and support education, encourage treatment engagement, and also make appropriate referrals when needed. And in the next module, we're going to shift a little bit into the history of HIV and AIDS and explore how fear and stigma and discrimination and public perception is going to continue to affect individuals living with HIV today. So when you're ready, proceed to Module 4.